So now we're going to move to adolescence. And this session is about the unique developmental needs of adolescents. So I'm going to start with the science. We're going to, the goal of all of that work on early childhood was to tell the story of unique opportunities at that period of the brain. So Dylan, what is unique about the state of the brain in adolescence? Can we start there?
Sure, just want to make sure this is on. Thank you for that incredible session on childhood. I think so much of that has inspired a lot of the work that we'll talk about today on adolescence. I think one of the things that has really stood out to me is that adolescence is a time of increased plasticity. And so this kind of narrative that what happens early matters, and that's the only thing that matters, has really been debunked in the sense that we know that there's so much opportunity for change during the adolescent period. And yes, it's a time of increased vulnerability, as many of the folks in this audience know. And we see, the peak of the onset of mental health disorders. We're here to talk about early adversity. There can certainly be really detrimental consequences of adversity during this time, or that happens earlier. And yet I think of this, and many of us do, I think, as really a second window of opportunity for plasticity and for intervention. There's a lot of reasons for this. One is kind of the unique state of the developing brain. And so what you alluded to, Lydia, and thinking about a lot of the work that folks in this room have led, really trying to understand, what is different about the adolescent brain. And we know that cortical limbic circuitry is in this really unique state. When I say that, I'm talking about, connections between prefrontal regions that play a really important role in regulation and executive function, and regions like the amygdala or the ventral striatum that are involved in reward and emotion. And in many ways, these systems, may confer risk under certain contexts for things like increased risk-taking, but they also confer unique strengths and opportunities. We've done some work on fear reduction and thinking about how there may be ways to really optimize what we know about how we can regulate fear during adolescence simply based on the nature of this circuit. And so I think the brain science has really been pivotal in kind of informing what those opportunities are.
That's great. Now, Shimica, on the ground, how has brain science helped, if it has, change policy for foster youth, juvenile justice, and what is there something you can tell us about what has worked?
Yeah, I think I'm really excited to be here today and to have been able to talk with Dylan a little bit more, because so much of what I think we've heard from the early childhood story is really changing the narrative around the capabilities of young people in this adolescence time period. And I know we have some lawyers in the law professors in the room, so they're going to talk about this probably a little bit more in depth than me. But I think being able to have the brain science really, take away some of the racial myths that were really prolific in the 1980s and 90s around young people being particularly black and brown young people, being super predators and irreparable in terms of the harm. And so I think that led to a lot of consequences in terms of our criminal legal system and how that impacted young people. And so I think having had the research, particularly in the juvenile justice space, really led to some seminal changes in how we view the young people's capacity and their ability, the understanding of it, inability to understand consequences, the proclivity to risk, which is normal. But it was not considered normalized at the time. And so specifically, I think across the country, beginning in 2015 or so, we started to see the Supreme Court really constitutionally mandate that young people are different than adults, and their ability to be culpable. And that shifted the way in which we began to prosecute young people, how we held them in solitary confinement, been able to say that they should not be impose the death penalty upon them, or life without parole. As my previous role as a lawyer, meeting young people or adult grown men who've been in prison since they were 17 years old, and someone saying to them, "You are never ever redeemable or rehabilitable." I think that is been some of the key pieces that we've been able to utilize to change the laws and practices of how we treat young people, specifically in the criminal legal system. Here in California, we were able to, again, follow that federal trend and reduce solitary confinement because the brain science said how horrible it was for young people to be isolated and alone, and what that does to their long-term psyche. So we have been able to really use that science for that critical period to do a lot to change in the criminal legal system. But even on the foster care system, I think we've been able to see more of the impact in terms of, again, racist policies that were rooted in that you should just snatch a child from their family and their family connections because of mostly the broad definition of neglect, which oftentimes is really a repercussion and consequence of poverty. And to be able to understand what those disconnections have meant for children and why it's important to talk about and reunification and work towards that is some of what brain science has helped us do.
And let's talk about the importance of social support in all of this. And so can you talk about, from your perspective, Dylan, how the science helps us understand what adolescents need and don't need on that front?
Sure. I think the science of adolescence and brain development really points to a few things. One is kind of the mechanisms by which social support is so important and how that might be influencing an adolescent, but also really how we can kind of optimize that for this specific period. Across many studies of early adversity and different types of trauma, we see time and time again that having strong social support, a caregiver who's supportive, a teacher, a friend, a peer, is one of the most potent protective factors in youth life. And yet, for decades, there was a lot we didn't know about how that kind of operated. And so our work and that of other folks in the room too has really shown that caregivers themselves have the potential to modulate frontoamygdala circuitry that I was mentioning earlier. For children to help dampen emotion reactivity. Megan Gunner's and others' work has shown that caregivers can actually buffer against higher cortisol reactivity in the context of stress. And I think this has provided some unique insights into the ways in which caregivers provide support. Increasingly, we're learning that, of course, that matters in adolescence too, but it's going to be different. And so, adolescents benefit so much from having people around them to support them, and yet we know that for adolescents, peers become increasingly salient. And I think at the neurobiological level, there's been a lot of interesting work showing how this operates. And we also know that caregivers continue to play an important role, central primary attachment figures in helping to buffer, maybe in more reward-sensitive contexts and helping to guide safe behavior. So thinking about what are the unique ways that we can kind of tailor social supports during this period.
I think it was Megan Gunner who said to me, she put it that you as a mom, you're not in their hypothalamus anymore. There was this, that really resonated and freaked me out, right? Shimica, what does it look like on the ground when you want to create policies and programs that support healing, and how can you fill in, how can you provide scaffolding for kids through programs and other things?
Yeah, I think I just want to add a little bit to what Dylan was saying earlier. And Phil kind of brought this up in terms of science being imposed or translated into communities, particularly marginalized communities. And I think part of what you just heard her say around caregiving is that we're like the last people to know that information, to know that we can impact our children in that way. And when you think about how we train social workers, how we train teachers, and how children enter the school to prison pipeline, or parents are deemed to be doing harm to their kids, when in fact they really just maybe not know in terms of why their child has neurodiversity, or what to do to be able to help support their child. And so I think that piece around having that information and knowledge as caregivers and supporters in community is really critical to being able to address, again, the policies and programs and investments that need to happen, because that information is often kept from communities of color. But in terms of what it looks like on the ground, and I'm so excited to see Taylor Dudley here from UCLA. I forgot the whole title, but Children because she was a part of this work for the last 6 or 7 years of how do we take what we knew to help change, LA County, which was the largest in the country of incarcerating young people. And we knew that that was not what we wanted to continue for fiscal, but most importantly for the human reasons of keeping young people locked up. But that took us building the case for not only why they wouldn't recidivate if you actually provided core programming. How could you divert young people before you even touched the criminal legal system, because we knew what harm spending one night in jail would do for them long term. And so that really took a lot of working hand in hand with the research, but also communities on the ground to push for the creation of different models. And so what we've been able to do in the last 6 years is reduce the number of young people incarcerated by 60% in this county. We closed 9 youth facilities. But the main thing is, what did we reinvest that money? Because when we were spending, $1 million to incarcerate a young person, that's disproportionate to the investment that needs to happen to them so they can live their whole and best of lives, right? And so I think part of that was working hand in hand and having the science to make the case for why the investment is better spent elsewhere. But then it also took the hard work of being able to create the programs to do that. And so we're really excited. The county has created its first Office of Youth Development that's not just focused on diversion, but the work that we're talking about here will help make sure that the investments aren't just about a young person does something that's risky and comes in and encounters the police, but how can we make sure we're providing opportunities in community to have access to youth programming, to have access to a connected mentor before. Exactly.
Can you, one thing you said jumped out at me about the idea of showing, for instance, what one night in jail will do and how it would have, so was there science that you used, and how did that get heard? How did you talk about that? Or maybe there's a better example, but that struck me as something very concrete that might resonate with policymakers of every stripe, and that, and they'd say, oh, wait, okay, I think this is a deterrent, but...
Well, I think first and foremost, it gets back to, I didn't hear her name over there, but from UCLA, talking about the lived experience being so important and critical to science and research. I mean, I think that part, Phil mentioned it too, sort of where the scientists are moving and the collaboration. But yes, policymakers understand, I could quote a study and says this is what it does to the brain, but it's not as effective of having a young person sit there and tell policymakers.
Bring them into the conversation.
Into the room to talk about what that experience did for them, how it creates PTSD, how one night of being removed from your home, what that creates to a child, whether they're 4 years old, 1 month old, 6 years old, 10 years old, and then taking 2 months to be reunited with your family, what that does. So I think that piece is so important, as you mentioned, about what are the questions that we're still not answering and discovering that can continue to lead to better development of policies.
Okay. And I know that you have views about how science should get communicated, and what we're doing, what we don't always do well. Do you want to share some of that?
Sure. Yeah, I think there's so much that's important to communicate, and yet as Phil and Judy and others have already pointed out today, how that lands can really differ depending on people's lived experiences. And so I think the science of adolescent brain development has already had such an incredible impact on society's thinking. And I think there are certain narratives, I think this applies in various domains, but I spend a lot of time thinking about early adversity that have become somewhat pervasive. One of those is that trauma or adversity can be damaging to the brain. And for the youth that you're working with, Shimica, that can be a very pathologizing message. And so I think some of the things that we and many others have been thinking at are, how do we communicate this in the nuanced way that allows for the science of plasticity to really take center stage, and this isn't deterministic in terms of the experience of adversity. It will increase risk for, let's say, mental health disorders in some of our work, but there are a lot of ways in which recovery is possible and healing is possible, and so we need to be putting the resources into the programs and the supports that can facilitate that. Another key message that I've found really important is really thinking about the brain as adaptive. It's incredible how children and adolescents adapt to their environments and the experiences that they've had. And so I think a lot of what has sometimes been, kind of painted as this picture of damage or impairment or problems makes total sense in the context of, say, a harsh or an unpredictable environment. My lab does a lot of work on anxiety and PTSD, and thinking about behavioral phenotypes like hypervigilance. That's a very natural and adaptive and survival promoting response in the context of having experienced trauma. Now, maybe as time goes on, that becomes less adaptive in new contexts, but I think helping to get those messages out can create a richer picture.
Does the concept of plasticity in the brain or adaptiveness resonate on the ground?
Oh, absolutely. I mean, I think we just have to think about how we frame it as we talk. But I think it's such a critical message. I mean, I think about the foster youth that I've worked with or have met, and how often they've been told they're damaged. Nobody wants them, right? Or the trauma they've experienced is something they're going to hold on to forever, versus being able to say, you can be healed. There's a possibility. You can adapt. You are resilient. You have strengths. You have assets. And the way in which we train, again, the people who interact with children to think that too. I mean, I think about just, the basics. We were just talking about ADD and neurodiverse children, and how before they were like, oh, those are the bad children. They just need to go sit down and self-control themselves, right? Versus, being able to understand that they actually have, lots of strengths and are brilliant, and it can be, but their neurodiversity requires different techniques. And so I think that piece is really so critical for a young person to know that they are not being in all of their trauma, but also that there's opportunities for the adults in their lives to be able to view and see them that way and change their behaviors. Because often we're imposing this stuff on children. They're not doing it to themselves. So we are telling them these messages about what they are capable of and what their brain is capable of, from whenever they've encountered these harsh adverse consequences at a young age.
I wonder if that concept of adolescence as a second opportunity for change in the brain, which again might imply that even after that there's an end again. And I know we don't want to do that, and happily for those of us who have been around for a while, change is always possible. But for me, that was one of the really pivotal understandings of that. New understandings of adolescent brain science, that in fact things open up again. So can we use that, in a way that will be effective with people? And also, just while I'm at it, for instance, you mentioned early, I think, that there's some sort of just facts that people need to know, and once they do know, like a parent might want to know, I know for early childhood or for hearing loss, which I know a lot about because I have a child who's deaf, the message that your child should get checked, their hearing checked right at birth, is something that most parents in this country don't know. And so you just need to make sure they do know that, and there's sort of basic fact that is important to share. But how do we share these facts in a way that is respectful and gives dignity, and is not still us telling us you scientists or officials telling people, how do you, is there a way to convey basic facts that are important for people to know without sort of stigmatizing the fact that they didn't know it in the first place? Maybe is how I want to ask that. I know I threw a bunch of things out there, but too many questions.
I'll let Dylan start.
Sure. I think to your first point, yes, the brain is always changing. There's lifelong plasticity. I think using language like heightened plasticity and really thinking about the unique strengths and opportunities of adolescence, coming back to this theme, when we think about adolescence as a period of, intense exploration and excitement. When I think about adolescents are so cool and amazing and have so many strengths. Like, that gives me hope. And I think we do, thinking a little bit about this thread of kind of community engaged work, we've been trying to do more work with a youth advisory board and youth in the community with lived experiences. And, you know, a lot of what they tell us is that these are the things that I'm good at. We've done some like photojournalism projects where they document what are the, you know, 5 things that you did this week that were most salient in your life, and we build a conversation around, you know, strengths. And I think that can be pretty powerful.
Yeah, and I think Dylan just hit it on that. It's conversations. It's not putting something on a spreadsheet and an infographic and sending it out. It really is community conversations, having trusted messengers to come and talk in, you know, strength-based terms about what this means. I mean, I think about, you know, we did a lot in California around home visiting, right? And we had a lot of, as advocates, we had a lot of hope about what home visiting could do, but we also had a lot of concern about what would it be like to have someone walk into a mother's house who just had a newborn, who maybe not have the best of circumstances, say, well, you need to do this and this and this and this for your child, knowing that lots of people have lots of concerns around system involvement and what that could do in letting someone in their home. But with the right kind of training and that could be supportive, it has had really positive impacts. So I think it's really about how do we train people to have the conversations in communities? How do we lean on trusted community partners by giving them that information to share? And then finding the different ways to be able to get that information out into community, but also to children themselves. Like we have an education system that doesn't educate children about their brains and what they need to know about their bodies sometimes. So I think that part is really important too.